As advertised, we're going to have a very quick little talk from Margaret. She's just going to bring some greetings to us. She's just asked me to introduce her as Margaret McDermott. So I will do that. But I did tell you that she is the and let me get the right title, okay? I do have an introduction. But she is the Parliamentary Secretary for Seniors to the Minister of Health as of March the 14th. But she's also been the Minister of Tourism, Trade and Investment, and Minister of Education, and a minister responsible for early learning and literacy. So she comes to us really with a wide understanding of our communities. And that's what we're here to talk about today. So thank you very much, Dr. McDermott. Thank you. You're welcome.
Well, good afternoon. Thank you very much for giving me a few minutes during your lunch, and I will be really brief because people need to have a little bit of break and get some oxygen. It sounds like a very dense day in terms of really a lot of knowledge to impart, and I think a lot of you know each other and would like to have some time to talk with each other as well. I'm delighted to be here, and I do bring greetings from Premier Christy Clark as well as the Minister of Health, Michael DeYoung. And I am the Parliamentary Secretary for Seniors in the Ministry of Health. So I'm really pleased to be here today for this event, which is at least in part to mark last week's World Elder Abuse Day, and I certainly was wearing purple, and I did see lots of people wearing purple that day. And yes, it was one of my favorite colors, so it's easy to do. Certainly here in British Columbia, we're like many other parts of the world. We do have a demographic change that's happening in our province, and our population is aging. We know that about 15% of our population is over 65 today, but 25 years from now, it will be over a quarter of our population. So we have older adults who are healthier and who are living longer, and we're delighted about that. But it does mean we need to be thinking about the demographic shift. And we certainly are committed as government to putting families first. And one of the things I was really pleased when Premier Clark appointed me was her saying that she wanted there to be a Parliamentary Secretary for Seniors. It's not a position we'd had in government before. She wanted to make sure that our older citizens understand really clearly that we know they're part of families, that a family isn't just a young family, you know, mom and dad with a couple of kids and maybe some pets. Our families are from 0 up until well over 100, and that seniors are an important, very respected part of all of our families. We've launched the Healthy Families BC strategy, which I hope you heard about. This is the most comprehensive health promotion program in Canada, and we're really proud about that. And certainly part of it is to address the needs of this growing part of our population, our older British Columbians, and encouraging us all to make healthy living choices. Great lunch, by the way, along the lines of the healthy living choices. And we have the Healthy Families BC strategy, which is supported by existing actions for a number of different population groups. One of these is our seniors, and you will have heard about the Seniors in BC Action Plan, a healthy living framework. So the framework provides our government with an action plan to support our seniors population in the next years ahead. And the Seniors Healthy Living Secretariat was created to lead the implementation of this really important framework. And what we're, of course, hoping to do is to help seniors to lead independent, active, and socially engaged lives. We're looking at things like age-friendly communities, where we pay particular attention to things our older British Columbians need us to pay attention to, things like transportation, housing, and community support. And I have to say that these are areas where it's critically important that we work with partners, and I know that many of you, probably all of you in the room here today, either formally or informally, are partners with us on our initiatives for older British Columbians. It's so important. This is something government cannot possibly do on its own. We have to work with our partners to do so. So in addition to things like addressing transportation and housing needs, we're also think it's very important to help seniors to stay connected to their communities with things like volunteer work, which we already have an absolutely huge population of seniors who do volunteer work in this province. And also by eliminating workforce barriers, which is another important thing to do. Many of our older British Columbians can and do want to continue to work. Now, we know that seniors are incredibly diverse. That when you think about a population that starts at age 65, in fact, by many definitions, even 55, some of the resources that we talk about in this conference today are available to people 55 and older. 55 up to over 100, obviously they will be diverse and they will have different needs. And so in addition to recognizing those different needs, also I want to talk about the fact that our government we really want to make sure that we're treating our older British Columbians with dignity and with respect, that we model that's the cultural norm here in British Columbia. And when I talk about dignity and respect, of course, it fits in very well with the theme of what you're talking about today. I was a family doctor prior to being elected, and most of my practice was in a little town called Trail. And I'm sad to say that some of my patients, in fact, my older patients, were victims of abuse. And it doesn't really matter what age you are when you see the most vulnerable people in society being abused, and especially when it's by someone that they care about, which it often was. And it was generally financial in my practice. It was generally a relative who was stepping over a number of the boundaries you're talking about today, and the alarms were going off, causing huge problems within families. I also had some patients who were scammed, and not only were they robbed of in often life savings or large amounts of their life savings, they were also just completely humiliated and didn't even want to come forward to talk about it. I had a patient who told me, but she told me she absolutely would not tell anyone else. And, you know, when patient-doctor confidentiality is on the line, there's really nothing that you can do about it. It's a person in full possession of her faculties, but it's awful to see. It's not widely known. It's not widely known or understood, and I think the public education piece is a big part of it, along with really good, solid changes in legislation to protect these vulnerable people. I said I'd be brief, and so I really do want to be brief. I just want to say to you that since I become the parliamentary secretary, I've had the chance to meet with a lot of people, both formally at meetings like this, and also informally talking with seniors and people who are part of community, part of not-for-profit groups. It strikes me that we have so many partners, we as government, we have so many people that are on the same page with us that really want to treat our older citizens, our seniors, if you will, with the dignity and respect that they obviously deserve, the great contributions they've made to our province and to us individually, and making sure that we provide an environment and a legal framework and knowledge so that their rights are respected, and that in the horrible event where they are abused, that there are ways that they can get help. So I want to really sincerely thank everyone for bringing your collective wisdom to the conference today and sharing your knowledge. I look forward to informally talking with some of you while I'm here. I'm going to be here for a little bit longer, part of the afternoon. And together, as we work, we can ensure that older adults live in safety and security, free from abuse, that they have absolutely great quality and quantity of life here in BC. Thank you very much.
Thank you very much, Dr. McDermott. I'm looking forward to all sorts of good things coming out of your appointment in this position. And it's nice to know we have somebody in your position who understands the problems and the issues that we're dealing with. It's very good. So I'm going to let you go back and eat and maybe have a quick tour around the block, those of you who need a little exercise, but I'd like to just draw your attention to the Minister's statement. This is the Attorney General Barry Penner's statement on financial abuse of seniors, which was one that Jay read at the beginning of our session today, and there's a copy on all your tables which you can take home with you if you like and read. So thank you to Harola from the PGT office for making this happen. Thank you, Harola. Take care. We'll be back, please. 15 minutes, quarter to 1, we want to start.